what you see behind us is putting to life all the work that the nursing staff, the direct care nursing staff, have done to improve the outcomes that they deliver to our patients, improve infection rates, improve processes that maybe weren't working right on their unit. But those nurses who are providing care at the bedside know best what to do to make things happen, make things work. And back here, everyone's telling their stories about it, and I think it's really impressive.
Today is phenomenal. The nurses have worked so hard. The unit-based practice councils, they had a lot of challenges this past year, so to see what they've been working on and see the progress they've made in this past year has been really fantastic.
What we did is we really wanted a practice model that reflected us at UC Davis, nurses, and what was important for us and how we really felt about patient care. And we're very family-centered care here, but that's just a part of what we do. And so what the council did is we set up salons, and we invited nurses to come into these salons in small groups, and we had 3 questions that we asked them. And the questions really helped us develop what nurses thought about the patients that they take care of, what was important to them when they take care of patients, what would be important if they were a patient, like what they would want if they were the patient or if their family member was a patient. So it really kind of helped us get to the root of what nurses thought was important in their practice. We have this pyramid that we developed, and it's really great because it has relationship-based care as the pinnacles, and then different areas of what's important and what builds that up into this pyramid apex. And we presented it to the nurses, and I think because it came from the nurses, it really is more meaningful to them. And so the nice thing is when you walk around and look at all of the different posters, some of them refer to the practice model, which really is indicative of the fact that it was so embraced by the nurses here. And I think it's something to be very, very proud of.
The purpose is to provide timely peer-based support. In the pediatric intensive care unit, we deal with trauma, child abuse, cardiac surgery, wide variety of different diagnoses. So what we're trying to do is provide timely peer support for our nurses who are at the bedside dealing with these critically ill children and their families. So when an event happens, be it a code or a death or something like that, we have a trained team to provide immediate support for our staff. We love our job and we very much appreciate what we do in the pediatric ICU, but it's very hard sometimes. And I feel like our coworkers are the ones that best understand what we do, so we can be the best ones to provide that immediate, that timely debriefing so we can help them through the grieving process of whatever they're dealing with.
People are very excited about what they've been working on, so excited, and I think that one of the things that I want to see is more nurse recognition, and this is just the first step. So I think that next year will be even bigger and better.